So a question I get always is about thyroid, right? Most of you know that I have hypothyroidism due to an autoimmune disease, which is what most people wind up having when they do the right labs. But essentially, one of the questions that I always get is they always ask me about whether or not I take a thyroid medication. I've ever been on Synthroid, levothyroxine, what have you. And the answer is no. I've actually never been on a thyroid medication. Now, even in the grand scheme of things, let's say I was on a thyroid medication, that wouldn't necessarily mean that I had none of the symptoms, right? Because when you look at the thyroid's pretty complex. But believe it or not, the real way that I see phenomenal results with patients with thyroid conditions is actually not going after their thyroid. By taking the stress off of the rest of the body, getting the liver working, adrenal glands, autoimmunes kind of balanced out, that's where the magic really happens. And that's where people start getting better. So it's kind of like you keep going after the thyroid and it doesn't genuinely get you results. Okay. So, real important to understand that when you have a hypothyroid condition.